Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of the series, we will discuss the disruptive effects that neuronal hyperexcitability can have on nearly every function of the human body and nearly every function of human society, effects that make it the most important of all medical discoveries. When so-called normally behaving people are compared to abnormally behaving people, the prevailing belief has been that differences in behavior are the consequence of numerous factors. Although this is undoubtedly true, there is actually one factor that is more important than all the others combined. That factor is the inherited trait of neuronal hyperexcitability. Evidence of this comes from the observation that a predictable proportion of children who are raised in dysfunctional households tend to carry the scars of the dysfunction their entire lives, whereas select siblings grow up largely unaffected by the dysfunction in their families. These so-called survivors, who appear in a classic autosomal recessive distribution, are not necessarily more mentally tough than their siblings, but rather more neurologically stable, presumably because they did not inherit one of the genes for neuronal hyperexcitability. Moreover, the fact that these children are more resistant to both mental and physical illnesses suggests that among the variables that contribute to the development of chronic disease, the trait of neuronal hyperexcitability is by far the most important. Behaviorally, those who inherit the genes for neuronal hyperexcitability tend to be either aggressive or passive. They tend to be reckless and impulsive. They tend to move from one job to another. They tend to have poor dietary habits and sleep quality. They tend to abuse alcohol and other drugs. They tend to be disruptive at home, at work, and in community, and they tend to have an elevated risk of suicidal behavior and homicidal behavior. Medically, they tend to have elevated blood sugars, they tend to be either overweight or underweight, and they tend to be more vulnerable to developing debilitating illnesses such as cardiovascular disease, autoimmune diseases, chronic pain, and cancer. In essence, the same chaos that is created behaviorally by the hyperexcitable brain is created biologically, thus making neuronal hyperexcitability the fundamental driver of nearly every psychological, behavioral, social, and medical problem in human society. It is also the most financially draining because it is the primary driver of healthcare costs, defense spending, legal costs, and public aid. Ironically, however, neuronal hyperexcitability is the most overlooked and poorly understood of all biological abnormalities. There are a plethora of therapies for nearly every emotional and physical disorder, but few address the root cause of nearly all of them. The reason for this is twofold. First, neuronal hyperexcitability tends to become asymptomatic during low-stress periods. Second, the abnormality is extremely difficult to detect despite numerous advances in medical diagnostics. However, there is mounting evidence that the abnormality manifests in a way that is as fundamental as its potential destructiveness, namely, in one's resting vital signs. The reason behind this is simple. Brain hyperactivity tends to drive autonomic hyperactivity, and autonomic hyperactivity is reflected in one's vital signs. What's more, neuronal hyperexcitability is highly treatable. The most natural ways to compensate for the gene abnormality that underlies neuronal hyperexcitability include stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar. If these interventions are either too difficult to implement or fail to yield satisfactory improvement, then treatment with neuroregulators and other brain calming medications may be necessary, particularly during high-stress periods in the person's life. The application of these natural routines and inexpensive pharmacotherapies can do much to reduce, postpone, or even eliminate the various psychological, emotional, and medical problems that are driven by neuronal hyperexcitability. But before this can be achieved on a large scale, the problem must be recognized. That is what this educational series is about. It's about exposing and ultimately eliminating the root cause of nearly every biopsychosocial problem known to mankind. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of this video and others in this series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of this topic can also refer to the scientific publication, The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.